Welcome, I'm so glad you all could join me. I'm Chava and you're watching Ask a Midwife. I heard from a woman who's expecting her first baby, and she's been writing to me over the last few months, and today she told me that in another couple weeks she'll arrive at her due date, and it occurred to her that she doesn't actually have the information she needs in order to go into the birth feeling confident, feeling like she has the skills and knowledge and tools to have the baby, to be able to get through the birth experience. She confided in me that her midwife hasn't really told her what she feels like she needs to know, and I recommended reading books. And then I thought about it. I think I'll do a video, because I think that through my 20-something years of experience, I think I could really help her. So I decided to do this video for you all. I'm gonna discuss with you some of the things I think you should know as you get closer to your due date and as you get closer to having your baby. I'm gonna talk a little bit about your attitude, your perspective, your outlook, things that your doctor won't tell you. I'm gonna talk a little bit about how to keep things normal, and I'm gonna talk a little bit about how to get the support you need, and about the process itself. We'll be delving into that a little bit today, and I also want to follow up with another more nuts and bolts video about the actual process of the labor itself, like what is actually happening in the body, not just about, the contractions will come and go every few minutes and then become more intense, but really more like what is actually happening in your body as you have a contraction. What is a contraction? What happens to the cervix? What is a cervix, first of all, but what happens and what's going on with the baby? These are the things I'm going to delve into a little bit deeper in a different video, but for this video I really want to concentrate on kind of how to keep things normal and the attitude with which you will experience the highest degree of success and satisfaction and joy with your birth experience. You don't have to be a trained doula or a trained midwife or a childbirth teacher or an expert in order to have a really healthy, empowering birth experience. You don't have to know a textbook's worth of information in order to make this a really great experience for you. You just have to know a few simple things, and I'm hoping that this video is going to help you. You might notice that your belly gets harder, and that's really normal. It's called a Braxton Hicks contraction. Your uterus is a muscle, and it needs to practice, and basically it needs to work out in order to do the job of labor, in order to do the job of pushing the baby out. So it's really, really good and common if you're doing a lot of, if your uterus is practicing a lot. Sometimes women ask me about red raspberry leaf tea, which is basically an herb that some women drink throughout pregnancy, throughout the second and third trimester, and sometimes it's combined with other herbs as well. But its job is to tone and strengthen the uterus. Some women think that red raspberry leaf is a induction technique or it's a labor stimulating technique. It's really just a nutritive herb that tones the uterus. So don't get confused. Some women call me, I'm done with this pregnancy, I'm gonna drink red raspberry tea and get this baby out. So technically that's not really the case, but it doesn't hurt to drink it. It does help. Okay, drinking any clear fluids helps and keeps you hydrated. And that's really, really important. Basically, as you would prepare for a marathon, a sports event, a big hike, anything that requires a lot of energy, a lot of stamina, I like to emphasize how similar the athletic activity of labor is to any other athletic activity, in that you need to be rested, you need to be hydrated, you need to be well nourished, you need to be prepared, you don't stay up late nights in a row. Try to really take care of your body, especially in the last couple weeks. It's a really good idea to take a nap each day. You're going to find that being well rested really, really enhances your coping skills. Okay, so let's talk a little bit about coping. I'm going to do another video about the physiology of labor and what's happening in the body. But since I wanted this to be a shorter video, I want to talk to you about the labor itself. You're going to have ideally you're going to have someone with you, whether it be your husband, partner, whether it be a doula, whether it be a mother, a sister, a friend, an auntie, anybody in your family, I recommend that the person who goes with you be a relaxed person, a practical person, somebody who calms you, someone who has that good calming effect on you, but a person who's prone to nervousness, prone to, overreaction, drama, panic. Even if they love you and they mean well, probably not going to be the best person to bring with you. And I suggest looking for someone, even if they have less actual knowledge about the labor process, find someone who has that calming effect on you. That's the best thing I could possibly tell you. And even if you have to pay for it, sometimes there are places that are sources of, like a doula training program, where you can contact the doula trainer, and maybe there's someone who's still looking to get their birth experience. Labor is a functional process, meaning the body knows what it's doing without you knowing what it's doing. The thing that happens, and this is the trick, is that labor, giving birth to a baby, is a far out experience. It's wacky and crazy and dramatic and intense and filled with all kinds of feelings that you don't normally feel on a regular basis. Passion, intensity, all these things. And that's really what birth is like. That it's really an intense experience for every woman. And there could be women who sing, and there could be women who moan, and there could be women who yell, and women who cry out, and women who recite mantras, and women who are silent. But they're all experiencing a variation of the same intensity, okay? So when we have somebody with us to calm us, to remind us that this is a process, that the body knows how to give birth. And before I tell you what a contraction is, how long it lasts, how to time them, what to expect, what's going to happen, and all the different things, I really, really want you to internalize this message. No matter how much you know about the process, your body will do it anyway. You can cooperate with your body by trusting the process, even if you don't know exactly what's happening to you. It's going to be really intense. It's going to be powerful. If you keep a good and positive attitude and bring a sense of joy and love to your birth, to your labor experience and your birth experience, the chances that the process is going to flow better, and it's going to be more rewarding, and the outcome is going to be more fulfilling for you. Because labor is so intense, when it's happening to you, you're like, what's going on? And you think, this can't possibly be normal. It's so intense and it's so powerful. And the things that I'm experiencing, like, one minute I can't talk, and the next minute I can't breathe, and the next minute I can't move, and then I'm running to the bathroom, and maybe I'm throwing up, and then there's some mucus coming out of me, or then there's some blood coming out of me, and I'm hearing this woman, moaning, and oh, that's me. It's a really intense experience. If you have the knowledge ahead of time to know what's normal, that'll calm you. If you have a skilled person, a comforting person, someone who has an intellectual knowledge of birth, a practical knowledge of birth, or just an inherent trust in you, your body, God, the process, whatever it is, as long as that person is there to ground you, you can do a lot to give yourself a really wonderful experience, even if you don't know, what's 3 centimeters dilation, what's 10 centimeters dilation, how to push, when to push, exactly when to cut the cord. All those things give a woman a sense of control, but really giving birth is about completely losing control and being okay with it. You're going to find that you'll be at a place in your labor where you have to let go, trust, and surrender to what's happening to your body for the process to continue. Women often get to a certain place in their labor with all their knowledge and their relaxation exercises and their meditation and their friends or their partners and all those comfort measures, and the massage and the back pressure and the birth ball and the side lying and the birth pool and the standing in the shower and hanging from your doorknob, or sitting out by your tree in the backyard, or going up and down your stairs, or all those things that women do. And they do those things throughout the labor, and then it gets to a point where it's like, oh my gosh, I don't want to do this anymore. This is really intense and hard, and I want to go home, and I want to be done, and I want to, some women say I want an epidural even if they really know that they don't. It's just the time where there's a porthole, there's a door, there's a passageway that they have to go willingly into in order to get through to the other side, and that's kind of a scary place. So if the birth assistant, the birth partner, can realize that there is a place and not get scared by that place and actually remind her, like, you're at that place now, you can let go. That's going to be, most of the time, that's what a woman needs in order to really make it to the other side. In order to she needs a little drop of confidence at that point in time. She needs someone to look in her eyes and say, you've got this, you can do this, don't be afraid, be brave. This is the way that your body's working. Your body knows what to do. You know what to do. Here, and then make a suggestion. Let's stand. Let's sit. Let's move you. Let's go let's go sit on the toilet. Let's get off the toilet. Let's stand in the shower. Let's lie on the bed. Let's get on the hands and knees. Let's try squatting. Let's try walking. Let's try going up and down the stairs. Put your leg up on the stool. Let's get into the bath. She needs to let's put music on. Here, smell this smell. Or maybe just stop talking. Maybe just be quiet. Maybe just put your hand on her, her lower back, or putting your hand right here, and you take a deep breath. You look into her eyes and give her a smile. Those are the things that a good birth support person, those are the priceless things. Those are the valuable things. It's going to give you a lot of confidence and strength to push through, literally. So this is a little bit about the process of labor itself. Things might start out with contractions coming every 10 minutes, every 15 minutes, lasting only 30 seconds, maybe 45 seconds, to getting more intense. And eventually you'll find that the contractions become more intense. And as they get more intense, they usually get closer together. As they get closer together, they usually get longer in length, maybe even a minute. At some point, they'll be regular. And that's when you know things are, when things are intensifying in that way, longer, stronger, closer together. This is a really basic thing to remember. Longer, stronger, closer together means my body's starting to progress. And especially if you see mucus coming out, like a discharge of mucus or blood even, those are signs that the cervix, the opening to the uterus, is starting to open, that labor is happening. Okay, and you can contact your care provider. Hopefully you have a care provider that will have invited you to contact him or her earlier, and just to let him or her know what's going on. But in my practice, I like women to call me as soon as they think anything's happening, and then I can discuss it with them and ask them, questions about the process and questions about what's happening to them, and get a feel for, have they rested, have they eaten, are they well hydrated. I just like to make sure that everything's going well, and I like to make suggestions. Remember, you haven't eaten. Oh yeah, I need to eat. And sometimes women have a really hard time eating in the beginning of labor. It's really important to eat when you think labor is starting, and it's important to continue to drink little sips of water throughout labor so you don't get dehydrated. Okay? Most women can give birth without any pain medication. Labor is a very uncomfortable process for most women, and labor is a very doable process for most women. Long labors where the woman is contracting for a really long time and she's unable to sleep, and maybe she's vomiting, she can't keep food down. That's a variation of normal. Labor intensifies, and sometimes women throw up and they have a hard time eating from nausea. It's still important to try. Sometimes women get exhausted, and exhaustion will really hinder the woman's coping abilities. It's hard to deal with pain. It's hard to deal with an intense feeling when you can't rest, and when you're just really tired, or you can't hold down food, or you can't hold down water. So that's a situation where you're going to want to have some help, either whatever, a pain relief, in the form of, laughing gas, nitrous oxide, as in our hospital we have. It's okay if you get to a point where you feel like you still have a really long time left, and you have been working for a really long time, really hard. It's okay to get pain relief if you need it. Epidurals nowadays, you can have a really good You can have a really good, empowering, healthy experience with an epidural. There are some risks with an epidural. I'll deal with that in a different video. But you always have to, in any situation, you always have to weigh the risks against the benefits. To anything, there's a risk and a benefit. You always want to look at which is more beneficial, to do it or not to do it. That's basically what I wanted to say about the epidural. At a certain point, things will intensify. You'll go in, you'll go to the hospital, you'll call your midwife, she'll come to the house, you'll call your doula, she'll meet you there, she'll come to your house, she'll see what's going on. In my practice as a doula, I often come to the woman's house and I check and see what's happening. We decide what to do once I get there. Or if she calls me and she says, you know, Chavah, it's really intense, I'm feeling a lot of pressure, or my water broke, and I can hear that she's progressing, I might just tell her to come to the hospital and I'll meet her there. In the case of a home birth, I'm already on my way. I think I've covered some of the most important things, but just to recap: rest, hydration, nutrition, those are the three biggest things. A support person, a calm support person who has faith in you, faith in the process, a basic knowledge of what happens during a birth. It's hard to bring a person with you to support you, and you're going through your experience, whether it's your first baby or if you've given birth before, and your support person who loves you is watching you go through this experience, and they're kind of really experiencing the birth as well. You know, they're crying at the birth. They're having, you know, floods of emotion. It's tricky when the person you've brought with you to support you during the birth is experiencing their first birth. It's important that your doula be a person who's the get-along type. When you bring someone into the hospital who has a bit of a fight in her, you know, she's a staunch natural birther and she's against all interventions, and she believes that every single woman could and should do a non-medicated natural birth. You know, nobody should ever be lying down for birth. Doctors always want to perform C-sections. Interventions are, you know, there are doulas with this kind of practice ethic, practice mentality, and it's not necessarily beneficial for the mom. It's not beneficial, and the hospital staff can smell these types of doulas coming a mile away, or in Israel a kilometer, and it's really not good, because then you get hostility and animosity, and that kind of thing is really bad for birth. I mean, she needs to be peaceful and calm and centered and confident, but a good communicator, and assertive when needed, but in a loving way. It's really tricky. So try to bring someone, if you have someone in your life, or you can find someone who fits those qualifications, that's a really good thing as well. But this isn't really so much about how to pick a doula as it's about what to set yourself up with going into the labor. Okay, I'm going to do another video on pain relief specifically. I will talk about epidurals, we'll talk about laughing gas, we'll talk about natural pain relief, we'll talk about positions, we'll talk about receiving pain relief through an IV. I hope this really helped you. I hope you're able to get something valuable out of this little video. Please subscribe. I'm really trying to get this channel going, and it means a lot to me if you could just click subscribe and like and pass it on if you think it could help someone that you know. Okay, thanks a lot. I'm Chavah, and I look forward to hearing from you.